Hello, and welcome to AFSPA Live, our monthly digital broadcast designed to give AFSPA members and eligible federal employees a place to ask questions and get answers about past AFSPA Talks topics, their benefits, and wellness needs. There are three primary ways you can join our broadcast. Join us live by clicking the link in this video description and following the instructions to allow access to your camera and microphone. Then, a show moderator will be available to assist you further. You can ask your question through the chat box on whichever social media platform you're streaming AFSPA Live, YouTube, Facebook, or LinkedIn. If you're not able to join us live, call our toll-free line prior to the broadcast at 888-435-0757 and leave our team a voice message that we may play back and answer live on air. Just tell us who you are and the question you'd like us to answer. I'll see you at the next AFSPA Live.
Hi, everyone. Welcome to AFSPA Live. We are a live broadcast Q&A session that we hold every last Thursday of the month at 11 a.m. Eastern. My name is Maddie Norton, and I'm a Junior Communication Coordinator at AFSPA, and I'll be moderating today. And today with us, we'll be discussing men's health because it is Men's Health Month. And so today we have AFSPA COO Kyle Longton with us, as usual. And then we have our special guest, Dr. Kelly Rule from Aetna. So let's go ahead and get started. I know we have lots of questions, and happy Men's Health Month.
Thanks, Maddie. And Dr. Rule, thank you very much for joining us. For those who were not able to join the webinar earlier this month, Dr. Rule is a Senior Medical Director at Aetna in the FEHB space, and he's also a flight surgeon with the Air Force. So this all in addition to his background as a family physician. So we are very fortunate to have him with us today and lending his expertise. So please send us any questions you have. He's ready to answer them, and he certainly has answered some what I thought might be stumpers for me over the years. So Dr. Rule, thank you very much for being with us.
Thank you. It's great to be here, and happy Men's Health Month. And happy late Father's Day also to everybody.
Exactly. Yeah. All right. So kind of get us started, we'll start with just a very common question. What are some of the most common health challenges men face, especially during various points of their life, maybe decade by decade?
Yeah, and I really appreciate this chance to talk a little bit about this because I think this is an area of health that, of course, is extremely common because half of us are men, but it's not talked about as much as it should be. And there's of course all kinds of important issues at every age, and I think we need to increase awareness at every point. So of course with the early years, childhood years, immunizations are a big issue. As the boys and grow into men in their teens and 20s, accidents and injuries are a huge issue, as well as some mental health and suicide concerns. And then as people move into their 20s, 30s, and 40s, there's continued issues with accidents and mental health and life changes and testicular cancer in early years. And then as, of course, the decades progress, there's more and more issues with heart disease and cancer issues and the importance of screening tests and seeking preventive care at all ages, but especially as people become older and have more and more things to test for and concerns, and then of course in the older years there become other geriatric issues and end of life concerns and growing incidents of that issue with heart disease and cancers and so there's important points to consider throughout the lifetime.
For sure. And I definitely think, a big thing is there's all kinds of things, but the number 2 leading cause of death for males, especially under 44, is suicide. And our statistics show that men are less likely to seek care for mental health due to, just the tabooness of it, which shouldn't be a thing. But can you discuss the importance of mental health in your role, especially since you used to be a family physician, and how you can kind of get past that stigma as a male?
Mm-hmm. Yeah, mental health is a huge part of being a family physician, and that's not just because of the area of medicine that family practice kind of sits in, but just because mental health is an important part of all of our lives. And in family practice, you tend to deal with just about every issue, and tend to try to focus a little bit more on the other parts of healthcare besides just the strict medicine. So mental health is always a special focus. Suicide is a huge issue within men's health. That it's The completions of suicide are a huge issue for men versus women, and there's definitely an underdiagnosis of mental health conditions within men within primary care. I think that's been an issue, and unfortunately, there's a lot more awareness now. And my main hope for everyone is that men and young men, especially not just older men, but men of all ages, consider talking and sharing their concerns with their doctor, whoever they're talking to about their health care or their mental health concerns, whether it be somewhere in chaplain or otherwise. But I think it's important for men to not be afraid to share their concerns. It's important for doctors and other healthcare practitioners to be open to asking and screening for it and discussing it. And I think it's important for men to be open to going out and considering things like counseling and therapy and just talking to someone who may have some expertise to help us all deal with life. And during my webinar, I gave the example of my Star Trek example because I'm a big fan of Star Trek, and the Next Generation has Counselor Troy, who always sat next to Captain Picard, and I think that's just such a great example of how in the future they kind of embedded this concept that everybody needs someone to help them with their mental health issues, and give advice, and it's just a part of life. And similar in the military, we have, for example, a chaplain who embeds with our unit and is always available to help with issues, and then other opportunities. And that's been a huge focus in the military, of course, with some huge concerns with suicide rates and men. Although there are a lot of women now in fields like police and military and fire protection, there's still a majority men in a lot of those roles, and there's a lot of issues with anxiety and PTSD. And so I think this is just a really important area to talk about. So I'm glad we're discussing it.
And I have a quick follow up. First of all, big fan of Next Generation myself. Second, I just want to say I appreciate us talking about this sort of front and center with today's discussion. I have a dear friend, family, and they lost a beloved family member at a young age to suicide, and the person was under treatment, and there weren't of course any indications or anything like that ahead of that. So I want us to be able to talk about this. And Dr. Will, as a family physician, one of the things that we hope for the Foreign Service Benefit Plan to highlight next year is that as part of an annual preventive exam, we cover, that's covered at 100% for our members. And part of that exam can be having a conversation about mental wellness. Um, do you have any advice for someone about how to have that conversation with their family physician? Most of us go in and we think, all right, blood pressure, we're going to do blood tests, we're going to check our weight and things like that. It doesn't always occur to us to talk about our mental wellness or any mental health struggles we're facing with our primary care provider. So how can we have that conversation?
Mm-hmm. Yeah, that can be tricky. There's a lot of kind of difficult topics that people encounter when they're going to officially see someone in the healthcare world, and I mean, there's lots of little techniques you can use. If you're really concerned or you don't feel like telling everyone, you don't have to mention it all right up front when you first go to the visit, especially if it's like a preventive visit, and then when you get in to actually talk to the person, you can not. Well, I don't like people to bring up too many things that they haven't mentioned ahead of time. But if there's something concerning you, let's say related to depression concerns or anxiety concerns, when you get in there, you can mention just at some point early on that you've just been feeling down lately or feeling really anxious or worried, and try to just kind of open up with something like that, and that will lead into more of a conversation related to those types of concerns. So just mention something early on about how you're not feeling right about something, or you can mention that something difficult's been going on in your life, and you're not quite sure how to deal with it. But as soon as you start to mention it, whoever you're talking to will have a lot of options usually, or an option to refer you somewhere else to help out. But that's always something important to not worry about bringing up. All of us have seen and heard a lot of things, and so there's nothing to be embarrassed about. And in fact, we like it. I think most of us family physicians, if and other specialties as well, like to hear from people on how they're feeling and how they're doing, and like to help out where we can. And if we can't do it all, like I say, we'll refer you elsewhere. But feel free to keep that on your list of things to talk about if you feel like you need to. And if you can't bring it up right away, bring it up at some point during the talk, and just mention that you've not been feeling well, and that'll lead to more of a discussion.
And I want to remind our members and actually refer them back to a recording of our broadcast last month. We had a great discussion with a mental health provider there, and that there are resources offered through Foreign Service Benefit Plan, including Teledoc, vHealth, MyStrength, Able2, other resources that are available to you at no cost that offer mental health support in various ways. So
Right.
thank
I
you.
think that's a great point, that during preventive care, the mental health screening is, I think, more and more encouraged to be a part of that, and covered within the plan. And then separate mental health care is also well covered, and behind the scenes we have a good behavioral health team that's helping to make sure that all the resources are available to our members. So we're working hard on case conferences, and sharing between the medical and our mental health specialists, and trying to make sure that all of our members' needs are met.
Absolutely. And just a reminder too, the number is now like 1 in 5 adults struggle with mental health. So it's not uncommon. And it's okay to talk about, like you guys have mentioned. Shifting from that, we do have a question from the audience. It looks like Frank from YouTube has asked, let's see if it'll pop up. He wants to learn more about approaches to treating GERD. I have throat irritation, too much stomach acid, too little, muscle issues, and he's seeing lots of online opinions. So what are your thoughts about that?
Well, I always look at and GERD, and of course dyspepsia, we call it, stomach upset. Acid is a common issue, and it's not necessarily a men's health issue, but I think certainly with some of the grilling and other things that come up with 4th of July, and otherwise, I think this is going to be a big concern for a lot of people, and there's no perfect answer to how to solve it. So you start with the over-the-counter treatments. In part, it depends on age. As you get older, you have to be a little bit more concerned about other things going on that you may need to be checked for. So I would always recommend that you mention it to your doctor whenever you next see your doctor, just so they can kind of go over the basic questions and make sure that you're considering everything, so that you're not missing anything unusual. Let's say like a potential cancer in your stomach or your esophagus, or there's other precancerous conditions like Barrett's esophagus that you have to think about that you may not have considered. So, and as your age increases and you go over 40, and the risks get a little bit higher, but things can still happen at any age. So always consider mentioning it to your doctor. And then the basics, of course, are over-the-counter medicines that you can take, like Tums. I don't want to recommend any specific brands, but you can always try that temporarily to see how you're doing. And then they've made more medications over the counter than we used to have years ago for acid. So you can get up to the H2 blockers and things like that. But you can, and there is a lot on the internet, as I heard, but you have to be careful what you read. So I would say you can try to follow and sort of an over-counter regimen for a little while. If it's just an occasional symptom and it seems to get better with that, you're okay. But if it's not getting better after a short period of time using something over the counter, then it's time to talk to your doctor. Or if it's happening more and more frequently, there's a lot of treatments. Still, a lot of it is medications. Some slightly stronger medications that you can work with your doctor on, that you can take for a certain period of time to see if you're feeling better with that. If that's not getting better, then you would usually get a endoscopy where they would look down inside just to make sure that there's no ulcerations or more complex issues, and they can check for other things, like H. pylori and other issues related to ulcers and stomach conditions, and just depends on what they find as to what they're going to recommend. And then still, usually medication solves the situation, but once in a while surgery is also an option to help reduce really persistent acid reflux. And there's some changes you can make, like maybe elevating yourself a little bit, your head of your bed, trying not to eat too close to when you go to sleep. Some of those types of lifestyle changes, which you can see online as well, help in some cases, but not in all cases. And I do see it says throat irritation in the question, and the throat irritation can be other things as well. But if it seems like it's related to kind of an acid taste in the mouth, then it's probably related to the acid reflux. Also, types of food that you eat can influence that. So the more spicy foods, for example, or in some people, caffeine, the different types of foods can influence it as well. So you can play with your diet, you can play with your lifestyle as far as elevating your bed, et cetera, and eating habits. And if it's not working and the medication over the counter is either not helping you on an occasional basis or helping you too often, as in you're getting this really frequently, even with the medications, then you need to reach out to someone.
All right. We have another question from the audience. This is from Carrie, and they have asked, 2 years ago, my father passed from prostate cancer. What are the warning signs, and what is best preventative care? Also, does prostate cancer affect male performance?
Prostate cancer is I think, of course, one of the biggest topics in men's health, and it's a very complicated issue, because there's been a lot of talk about trying to catch it early and diagnose it, and the only thing that we really use now is the PSA test, or the blood test, to catch it. They used to recommend a rectal exam to check the prostate as well, but that's no longer, it just hasn't been shown to make much of a difference. So the PSA screening test is not a perfect solution, unfortunately, and that's been one of the reasons that there's been so much discussion about this. The screening test is usually started around age 55, if you are going to do it, and it could be earlier depending on risk factors for cancer, but starting it early has been kind of controversial, even if someone has a risk factor for prostate cancer. But you can do a PSA test, recommended starting at 55 and older if you're going to do it. And warning signs for prostate cancer are usually urine problems. So there's not usually a lot of pain or other symptoms. It's you're having urgency, frequency, hesitancy, kind of similar to urinary infections, or to the benign or the harmless causes of prostate enlargement. So it's hard to tell sometimes what the source of the cause is. But if you're having trouble urinating, waking up more frequently at night to urinate, feeling like you're not able to empty your bladder, symptoms like that could be a sign of it. And blood in your urine sometimes, but not necessarily usually related to prostate. And as far as well, I'll go back to the screening real quick, because there's a few more things to say about that screening, testing, and treatment. But does it affect male performance? It can, and especially as the prostate gets more and more enlarged from the cancer. Basically, it's just kind of an obstruction issue. it blocks things as it gets bigger, and so there's not as the same abilities um, uh, for the sexual issues. But the challenge, and when you mention male performance, the big problem with a lot of prostate cancer issues is the testing and the treatment often are the main things that affect male performance and quality of life, basically afterwards. So that's the controversy of whether or not to test, because if you test everyone early, most people, it's found, it's about, I believe it's about a fifth of men, if they die at any age in their autopsy, they have prostate cancer. When you get up to age 90, it's about half of all men have prostate cancer at death. So basically, most people have prostate cancer in their lifetime and don't die from it and don't have any symptoms of it. Most people who have prostate cancer. So testing for it doesn't necessarily make a huge difference in terms of mortality or long-term reduction in death rates. And testing leads to biopsies and leads to other procedures that can affect urinary function, other aspects of male performance, and all too often, where someone, if they hadn't been tested and hadn't known that they might have a potential positive for prostate cancer, never would have had an issue. And then when people are treated for prostate cancer with surgery, with radiation, there's a lot of long-term, lifelong changes that someone may not have needed if they hadn't tested themselves for it. So it's a long answer. Prostate, you can say a lot about that, and definitely if you're having urinary symptoms, it's worth getting evaluated and considering what the source could be. And there are treatments to help with flow if the prostate is just enlarged. So you can even, you always have to discuss with your doctor whether you want to actually do the cancer test, but you can also consider treatments for just an enlarged prostate, which is very common as men get older.
And Dr. Rule, you mentioned that sort of the prevalence of prostate cancer goes up, and people may not even know it, and it sounds like my recollection is that we stopped testing, that the medical community sort of come to a consensus of not testing, doing the PSA test sort of at age 70 and older, because is it that prostate cancer is sort of a slow growing cancer, and it's likely that at that age something else will be the cause of mortality rather than prostate cancer in most circumstances.
Exactly. Yeah, it's a combination. That's always the tough part of a range of screening ages, is when to stop it, when to start it, and when to stop it. And when to stop it is almost as complicated as when to start testing. Usually with prostate cancer, that's the issue. Once you get past age 70, most of the screening doesn't actually catch anything that's gonna result in any real medical or health issue during that person's lifetime. And so if you're over 70 and you're having some new symptoms, you can definitely work with your doctor to decide what you're going to do about it. But just general screening in someone who doesn't necessarily have any symptoms, you wouldn't want to do after 70, because at that point, finding a positive test is going to be a fairly high possibility, but you wouldn't really statistically want to do anything about it. So that's the reason to not do it, because of the slow growth of it, and the fact that it's fairly common. All cancer is bad to a certain extent, but there's still different levels of concern, and prostate cancer in an older age is fairly common, and not doesn't have all the connotations of some other considerations with other types of cancer at earlier ages. So it's kind of like skin cancer, where you have different types of skin cancer, and they're all concerning, but if it's not melanoma, it's a little less of a concern. So right, that's why they don't recommend screening after 70.
And just reading between the lines of Carrie's question, is prostate cancer particularly maybe a form that may come on earlier, perhaps in someone's 50s or something? Is that something we tend to see that runs in families and may lead someone to want to pursue tests at an earlier age, obviously in consultation with their doctor? But is that, obviously it's prevalent among men, particularly as they get older, but sort of that earlier onset, is that something that runs in families?
It does seem like sometimes there is a connection to genetic predisposition, and most conditions seem to have a certain association with genetics, and running more common or earlier in certain families. So that's always a concern. The data still doesn't necessarily show that there's a lot of difference in testing earlier if you have that family history. And there's other risk factors, for example, if you're African American, that they used to recommend a little bit more aggressive testing, but it's been kind of controversial in the literature. So some people suggest getting tested between 40 and 55 if you have it in your family at a fairly high rate or at early ages. You can consider doing that, but it's just controversial on how much of a benefit there is from it. So there's nothing wrong necessarily with not doing it, but again, that's an individual discussion with your doctor, especially if you have the family history. And that just depends on each person's kind of comfort level and concerns and goals with their life, and just considerations of the risks and complications from the biopsies and the treatment that they could open themselves up to if they start to test.
All right. And kind of on the same topic, we did have a member ask, are there other types of cancer that affect men? I know there's testicular, colon. What are your kind of preventative care tips on those, and when should screening happen? We'd love to hear about that.
Yeah, great question. And top two talked about cancers are prostate and testicular. The highest for risk of death is colon cancer, and then lung cancer in men. So prostate we talked about. Testicular is the most common cancer in young men, and but that testicular is a tricky one because we don't have a good solution to testing for it. They used to recommend testicular self-exams and exams when you go to the doctor, but those don't seem to show that much benefit. And the other good thing about testicular cancer, if there is, I mean, it's still a horrible experience whenever anyone gets a diagnosis like that. But the good thing is it's usually very curable. So definitely in most cases when it's caught, it's they're able to cure it. And so then colon cancer and lung cancer definitely have prevention options that are good to consider. So colon cancer, there's been a lot of talk about it possibly becoming more common at earlier ages. They've changed the recommendations in a lot of circles to try and start to check for it at age 45 and older. There's a few different ways to be tested if you're at kind of average risk or you're not high risk. If you're high risk, the standard is usually still the colonoscopy starting at 45 and then doing that at least every 10 years. And that depends on what their findings are and what your doctor feels about your risk. So starting at 45 colonoscopy, there's a few stool tests now that can be done usually annually that will check for colon cancer, that if you're not at high risk, you can consider doing those instead if you absolutely don't want to do a colonoscopy. That's still, colonoscopy is considered gold standard, but you can consider some of those other stool tests instead, just at a higher frequency. And then they're working on imaging, CT and MRI, virtual colonoscopies to look inside the intestine, and those are starting to get better, but they're still kind of not highly used right now. They're still a little bit costly, and there's still some invasiveness to the test to prepare you for it and things like that. So there's a few options for colon. Again, the upper age, there's been some variability in how long to test for it, but there is an upper limit to which you don't have to keep testing. Lung cancer, there is a screening test for that as well. Chest X-ray doesn't work for lung cancer, and then of course with lung cancer, but tobacco use is the easiest way to avoid it if you can. Lung cancer, between starting around age 50, if you have a significant smoking history in the past, then it's recommended to do a type of a CT scan, sort of a quick quick imaging scan that just checks for cancer within the lungs that has been shown to be very effective. So that's recommended starting at age 50 if you have a heavy history of tobacco use.
All right.
And that's annual as well. Mhm.
All right. So we are coming up at 11:30, but we do have a couple of more questions, so we're going to keep going if that's okay.
Sure.
So we do have a question from, it looks like Robert has asked, let's see, any male-specific dimensions / strategies to averting dementia? I hear few men get dementia. Is that just a factor of longevity?
Yeah, dementia. Well, it's there is not really a good solution to dementia. I mean, there's so much talk about it out there in the media, and so many medications and over-the-counter supplements that are out there to try and help improve the mind and reduce the risk of dementia. But actual dementia is still a clinical disease. It has changes in the brain, and they haven't really proven that anything avoids it. I think there's a certain psychological component to people trying certain types of supplements and otherwise to feeling better. I'm just a big supporter of healthy, varied diet, a variety of healthy foods. So lots of fruits, vegetables, seafood. I like the Mediterranean diet. I just think a healthy diet and good exercise seems to help with a lot of things, including the mind and risk factors for dementia. I think it's still kind of controversial, but sometimes use of the mind and mind exercise seems like still a good thing to help reduce long-term issues with dementia to a certain amount. Although again, like I say, that's somewhat controversial. And as far as hearing few men get dementia, factor of longevity, well, I mean, it's fairly common in men and women, and yes, it does increase with age. For there's again a kind of a genetic predisposition, and some people tend to get it earlier, sometimes much earlier than others, but still for the most part, it increases quite a bit as one gets older. Mhm.
All right. We're going to kind of pivot to, I would say, younger ages. Someone has asked, is there anything I can do to improve my chances of becoming a father as a male, obviously?
Right, yeah. And that just depends a lot on the reason, I guess, that someone is having some concerns about becoming a father. And so if it's related to infertility, let's say, or trouble having a child, we have kind of the medical diagnostic categories for when someone is considered to be infertile or unable to have a child. So first rule is, of course, to have been attempting to be a father for usually a year on a fairly regular basis, and before you consider that there may be a problem, and or for 6 months if you're in kind of an older age group, still attempting to achieve pregnancy. So if you've been trying and have been unable to for usually for a year, then you can consider other options. And so usually that means doing some testing. So and for the man and the woman, there can be some testing that can be done. And as far as a father goes, there are some tests that there are problems with sexual dysfunction that can be found through testing that can help to identify what the problem might be and see if there's any options for improving things. And then after that, then it's a consideration of what was found that was wrong that could be fixed in both the man and the woman, and if there's difficulty trying to fix it that way, there's other options. Of course, like assisted reproductive technology and otherwise, which can get complicated and costly depending. And we have that's also a benefit discussion, I think. But there's a few options to consider. So that touches on a few points. There's no, I guess the other question is there any kind of supplement or otherwise that will help increase someone's chances? And that, again, just like dementia is controversial. There's all kinds of supplements and thoughts and ideas, and even, we didn't talk too much about testosterone, but there's some people who feel like that might help, but that's kind of not really something that you would do to help with that either. So there's not really any good solution to what you should do specifically, other than, again, being as healthy as you can. So healthy diet, fitness, if you're trying to figure out what to do, work on your diet and work on your fitness. Try to eat as healthy as you can: fruits, vegetables, seafood, things like that.
And I just want to add that we explored this in a little bit more detail with one of Dr. Rule, with one of your colleagues, Dr. Pritzker, in a podcast last November. So I would encourage those who are interested to go back and listen to that in the AFSPA Talks feed. And you've got the information there on the screen now. Thank you. But we talked about this and sort of got into more detail about some of the testing that can be done, and also that the Foreign Service Benefit Plan does provide coverage for that diagnostic testing, to find out if infertility is being experienced, what the sources are, and if there are medical procedures that can be done to enhance or create fertility. So there's information in that podcast as well as in the plan brochure, to the point of for Dr. Rule, talking about assisted reproductive options. We do have limited coverage for that this year. You will be seeing changes coming to all FEHB plans in 2024, following a OPM mandate. So expanded coverage for ART procedures. Specific details will vary from plan to plan, but look for that next year. And I will just say, as someone who in my personal life did struggle with conceiving, my wife and I struggled for over a year to conceive our first children. That I'm glad that we consulted a fertility specialist when we did. We were fortunate enough not to need to go to ART procedures, but we had options in front of us, and had the test results and options for moving forward with that. So don't be afraid to have those appointments. Don't be afraid to talk about it. It does seem, sometimes it comes across as taboo, or it's, we're something less than maybe what we should be. No, these things happen, and fertility is on the rise, and across the world, but particularly it seems in Western countries, we're seeing statistics showing that. So don't be afraid to have those conversations with your primary care provider, as well as with a fertility specialist you can find. We have institutes of excellence providers across the United States who have fantastic results in helping people to determine any sources of that, and also options. So this is, we tend to think about this maybe too much as a women's health issue, but it's also a men's health issue. So another place for us to remove stigma today.
Yeah, that's a good point. People need to talk about these things and not feel afraid to talk about these, just like the mental health issues and other issues. This is common. There's a lot of awareness now about this, and it's definitely something to talk about and think about. And that's when you're in the medical world, it's not just the woman's issue on why she can't become pregnant, but there's often can be a male factor in it as well. So we always recommend testing for that. And one other thing I wanted to mention, as far as the cancer screening before we end, was, if my slides from my webinar have all the kind of the specifics on the frequency and the begin age and the end age for all the testing. And the other thing I wanted to mention for everyone is, if you have any questions, I always love the U.S. Preventive Health Services website, the U.S. Preventive Health Services Task Force, which you can Google and take a look at. And that has all these different conditions, like the lung cancer screening tests and prostate and testicular and everything else. It addresses it, it gives the recommendations, and it gives the age ranges. And it has a great discussion on why they feel the way they do. So if you want to know all the controversies about prostate cancer testing and everything else, that's the place to go. That's a fairly good, unbiased source of information.
Yeah, and I think a great question to kind of wrap up today's discussion, and especially the how we've talked about how the importance is making sure you are going to the doctor to get these things checked out and stuff like that. do you have any advice on how men can incorporate visiting the doctor in their, day-to-day routines, their annual routines even?
Yeah, and that's a big topic. Why? And one of my favorite things to think about is the life expectancy in men versus women, and you'll see a gap that's been there that hasn't always been there, that started to form kind of around the 1890s. It seems is where things separated, and we the gap got up to 8 years. It's about 6 years right now, but it's interesting because it's not really. It doesn't seem to be a specifically genetic issue. It's more of problems with prevention in men. And so one of those issues is that they don't seek preventive care. Well, part of the issue is some of the accident and injury issues, but part of it is not seeking care so early, I should say, so that they end up being diagnosed later. And so how to incorporate it? Well, one of the big challenges, I think, and if you have family members who are younger, men, and we've worked with this issue within Aetna, trying to encourage young people from 18 to 30 to go to their doctor. I think it's good as a parent or a brother or sibling to encourage other young men to go to the doctor occasionally just for a checkup. I think even if they haven't thought about it, they should just go and do it. That'll give them a chance to be screened, to discuss issues, to bring up issues that they may not have planned on talking about, as long as they're sitting there with their doctor, and their doctor will have a chance to ask questions, or nurse practitioner or physician assistant or whoever they're seeing. But that's a great opportunity at an early age to kind of force yourself and encourage people that to try and go in early. And then later in life, there's all kinds of interesting reasons for why men don't tend to go as often as they should. I think there's some kind of social issues involved in it. There's people feeling too busy to go, of course, and there's a certain amount of denial, and I think sometimes fear that people don't want to know. Men don't want to know that something's wrong, or they don't want to show that something's wrong. So I just say, if you haven't, as far as an easy way to work it into your life, there's not a super easy way. I think you just have to force yourself to say on a regular basis, I'm going to go, whatever that frequency is. Of course, we like to say annually. As for sure, you should be setting a certain frequency. If you haven't been in the past year or two, you should make some time, and you should try to say, I'm going to make some time for myself on a regular basis, ideally once a year, but at least once every 2 or 3 years, to get checked out. And when you go, and you just make a preventive appointment with your doctor, go in and just make sure that you're up to date on everything that you should be up to date, and have any screening and blood tests or otherwise that you need. So it's a matter of forcing yourself to remember that it's got to be a priority, and to remind yourself that you need to do that so that you can help everyone else that's important in your life. If you have a busy job, you're not going to be able to do your busy job if you're not healthy. You're not going to be able to help your family if you're not healthy. So you've got to try to find some reasons to motivate yourself, force yourself to take a day and devote that to your doctor visit, and making sure that you're up to date.
Absolutely. And I think kind of what you hit on at the end of that was, do it for your family, your loved ones, your friends, coworkers, and most of all, do it for yourself so that you're around longer and can prevent anything that may be bothering you.
Mm-hmm.
And to kind of wrap this up, Dr. Rule has mentioned his webinar that he did with us. That is on our YouTube channel at AFSPA Cares. You can watch that and see all of the slides that he made, and a bunch of statistics as well. You can find a recording of this on our YouTube page as well once this is over, so you can watch back and see anything. And we will be back again next month at the last Thursday. I believe that's July 27th. And you can find us on all of our social media channels. And we really, really, really appreciate Dr. Rule being here to talk about men's health. And that is such an important topic. And we hope that we've encouraged men, or motivated someone who cares about them, to kind of motivate them to go to the doctor, especially with COVID and how long it may have been since someone has last been seen. So take care of yourself, and happy Men's Health Month.
Yes, thank you very much, Maddie. Thank you.
Thanks for watching our broadcast. Join us again the last Thursday of every month at 11 a.m. Eastern. Also, don't forget to look for AFSPA Cares on all of our social media channels: YouTube, Instagram, Facebook, and LinkedIn.